Success with Diabetes Managing Stress, Session 6. In this video, we will briefly review what we talked about in the earlier videos, then have a deeper conversation on stress, depression, and diabetes distress. Before we get into this week's main topics, let's review some old material. Type 1 diabetes is an autoimmune disease where the body does not make enough insulin. Type 2 diabetes is caused by insulin deficiency and/or insulin resistance. But inflammation is the main cause of diabetes-related complications. Higher blood glucose, long-term, leads to inflammation of the blood vessels. This occurs in different parts of the body and can lead to complications, including heart attack, stroke, diabetic retinopathy, kidney disease, peripheral neuropathy, poor wound healing, and in some severe cases, amputation. Here are some numbers to remember. When checking your blood glucose, the fasting goal range should be between 80 and 130 milligrams per deciliter. The target 2 hours after a meal is less than 180 milligrams per deciliter. Hypoglycemia is blood sugar less than 70 milligrams per deciliter. If this happens, follow the 15-15-15 rule. Check your blood sugar. If it's under 70, take 15 grams of fast-acting carbohydrates, like 4 glucose tabs or a half glass of juice. Wait 15 minutes, then check your blood sugar again. If it's under 70 milligrams per deciliter for the second time, then consume 15 grams more and repeat the cycle. If it's still low, use a glucagon kit or call 911. Remember, don't wait for your family to come home and don't drive yourself to the hospital. It is very helpful to keep a record of when these episodes happen. This information can help you and your healthcare team figure out if there is a pattern to these low blood sugars and if your medications need to be adjusted. Contact your provider if your blood glucose is greater than 400 milligrams per deciliter. Go to the hospital emergency department if your blood glucose is greater than 500 milligrams per deciliter, or if you have a change in symptoms, feeling thirstier, drinking more fluids, urinating more, or feeling stomach pains or stomach upsets. Being sick can cause your blood glucose to increase, so remember to have a sick day plan. A normal A1C is 5.6% or less. People with diabetes have an A1C of 6.5% or higher. In general, an A1C of less than 7% means that diabetes is under control. Talk to your provider about what your A1C goals should be. Generally, it's recommended to get physically active for at least 30 minutes a day, 5 days a week. Talk to your provider before starting a new exercise routine and ask about any special precautions you need to take. Always make sure you have comfortable, well-fitted shoes. Remember to check food labels for hidden carbs. Choose whole grain over refined grains because whole grains have a lower glycemic index and more fiber. Remember, the glycemic index of an item of food tells us how fast it increases our blood sugar. Think back to our orange juice and bread demonstration. The white piece of bread breaks down quicker than the whole wheat piece of bread when soaked in orange juice. Because white bread is broken down quicker, it increases our blood sugar more quickly than whole grain. That means that white bread has a higher glycemic index. There are different kinds of fat. Avoid saturated and trans fat. Consume fats from fish or plants, like salmon and avocados. Limiting the amount of sweets you consume is very effective in keeping your blood sugars more steady. Remember, you can still enjoy food. You just have to make substitutions or be more mindful of the amount you eat. Moderation is key here. Having a chronic disease like diabetes can be difficult and overwhelming at times. It can be very demanding, and can lead to feelings of depression, anger, anxiety, and frustration. But these feelings and concerns can be reduced with the support of family, friends, and your healthcare team. What is stress? Why do we get stressed out? Stress is the body's response to perceived danger. This can be real physical threats or threats in our mind. Stress served an important role when we were hunters and gatherers. It's responsible for the fight or flight response. If you were a hunter in the past and saw a bear, you would either fight the bear or run, flight, from the bear. Both require a lot of energy. In order to do this, the body releases a hormone called cortisol. Cortisol then makes more glucose go into your muscles for quick fuel, so you can fight harder or run faster. Regardless of what makes you stressed, it is a very real feeling that affects our body. Usually, we're deep in thought while stressed. People sitting on the sofa, standing in the kitchen, but not necessarily running from a bear. This means that when your glucose levels increase due to the stressor, our skeletal muscles aren't using the extra glucose in the blood. We can't always control stress, so it's very important to be extra cautious of high glucose levels. If you are stressed, you should assume your sugars will rise due to cortisol. During times of high stress, it would be helpful to check your blood glucose more often. If your sugars are running higher because of stress, it will be helpful to eat less carbohydrates, continue to take your medications, and get some physical activity. Possibly go on a walk to get some fresh air to clear your mind. So, what can we do to cope with stress? Be active, confront the problem and seek a solution, or be passive, avoid facing the issue. If something is causing you stress, which do you think will be more effective? When we are active, we are more likely to find a solution and solve the problem. If we are passive, we are basically ignoring the issue and hoping it will go away. This may be tolerable for a while, but it won't always solve the problem. An example of this would be being stressed from not being able to afford your diabetes medications. If you are active about this issue, then you can contact your provider to help you find a cheaper alternative. Maybe you'll also start to cook healthy meals at home instead of eating out to save money. If you are passive, then nothing will change. Sometimes, stress can be so overwhelming that it can lead to depression. People with diabetes are 2 or 3 times more likely to become depressed compared to someone without diabetes. People who are depressed are more likely to get diabetes than someone who is not depressed, even after accounting for weight and lack of exercise. Depression is a disease that affects a person's mood and can interfere with many aspects of a person's life, including sleep, mental and physical health, appetite, and energy. Depression is a chronic condition, unlike sadness. Sadness is temporary, but depression can last months or years if it's not treated appropriately. Let your provider know if you've experienced any of these symptoms: loss of interest or pleasure in activities you once enjoyed, persistent sadness and sense of vulnerability, persistent feelings of guilt, frequent insomnia or increased sleepiness during the day, spontaneous and frequent crying, too little or too much of an appetite when compared to usual days, thoughts of death or suicide. How does depression affect people with diabetes? Depression affects 20 to 25% of people with diabetes. Being depressed can make diabetes worse if the person is not following healthy habits. Having diabetes can also make depression worse. It's also harder to tell the difference between symptoms of hyperglycemia, hypoglycemia, and depression. So, how do we treat depression? By support groups, regular exercise, spending time with family and friends, and practicing stress reducing techniques such as meditation, yoga, Tai Chi, or prayer. Treatment may also include taking antidepressant medications or psychotherapy with a licensed psychologist. How can depression be prevented? Many activities that can treat depression can also be used to prevent depression. Support groups and counseling, regular exercise, and spending time with supportive family and friends can help. Practicing stress reducing techniques every day, such as meditation, yoga, Tai Chi, or prayer, may also be beneficial. You can participate in yoga classes or Tai Chi with others, or you can practice stress reducing techniques at home. Find something that works for you. Like all habits, it may be difficult to incorporate into your daily life at first, but over time, you'll see a change in your stress level and overall mood. Depression is very real and serious. It's important to address this issue early. If you feel like hurting yourself or someone else, then please reach out to your provider or call Lifeline at 800-273-TALK, 8255. This number will connect you to someone to provide free and confidential support 24/7. You can also visit suicidepreventionlifeline.org for more information. Symptoms of depression can overlap with symptoms of diabetes distress. Diabetes distress refers to the emotional symptoms associated with the burdens of diabetes and its treatment. These symptoms can be similar to depression and include feelings of stress, guilt, denial, anxiety, and depression. Worrying about the quality of life, hyperglycemia, not meeting blood glucose goals, insulin injections, understanding your prescribed treatment, complications related to unmanaged diabetes, and a lack of social or economic resources are real issues that can worsen symptoms of diabetes distress. When it comes to self managing your diabetes, you may become frustrated after not seeing any changes despite your best efforts. Here are some ways to optimize your diabetes self management. Talking about complications related to diabetes can be uncomfortable and distressing, but ignoring the problem is not helpful either. Take it slow and discuss your concerns over multiple visits with your healthcare provider. Take in a little information at a time and give yourself time to process the information. Knowing more about diabetes and what complications can arise is the first step in preventing them from happening. Oftentimes, you may not notice any symptoms, so getting regular screenings is the best way to catch complications. How confident do you feel about making these changes? Adjust your eating plan, especially when you're away from home. Check and adjust your blood sugar when necessary. Maintain a healthy body weight. Take medications as prescribed. Diabetes is a life-changing and long-term disease. If you feel confident about making these changes, you may be less likely to feel distressed. There's so much information to learn. It's okay if you don't understand any piece of information presented to you about caring for your diabetes. It's common to doubt yourself or feel unsure. What's important is that you continue to ask your provider to clarify what's unclear. Tell them what you understand and what you're doing. That way, your provider can help you troubleshoot if needed. You are part of the diabetes care team, and your healthcare team members want to know how they can support you. You are the most important member of the diabetes care team. You do a lot of work. You monitor your blood glucose, take medications as prescribed. You follow a diet or exercise plan. There can be many different factors that get in the way, such as a lack of finances, feeling like the medications aren't helping, having a meal, medication, or exercise plan that's too complex or doesn't fit with your lifestyle, forgetting to take medications, medication side effects, or not having enough support. When it comes to medications, always take them as directed. Talk to your provider if you have concerns regarding side effects or how the drugs are working. It's best to be honest with your provider about which medications you are or aren't taking. It's better for safety reasons. If you're finding it difficult to reach your goals, then reevaluate them. Make sure that the plan you and your healthcare team came up with fits your lifestyle and your specific needs. There may be some personal, family, or cultural reasons why it's hard for you to stick to a certain plan, so customize it so that it's easier to follow. And remember, be realistic and set goals that you can achieve. This type of mindset won't just help you with your diabetes, but will help you feel more in control and benefit other aspects of your life. Carry this mindset with you when changing any habit, big or small. Different types of eating disorders can occur in people with diabetes. Eating disorders can include eating too much or too little, binge eating, or night eating. Someone on insulin might skip insulin doses to lose weight. Some people may feel like they're always hungry, but this can be a consequence of having diabetes itself. Diabetes can affect your brain's satiety center. Satiety is the feeling of fullness. So, diabetes can decrease your brain's ability to sense that you are full. You can also be excessively hungry if your medications drop your blood sugar too low. Do you ever eat a lot after dinner or have trouble sleeping, then eat more when you wake up at night? If you do, then you might have night eating syndrome, and you should let your provider know about your symptoms. There are medications that can help with blood sugar levels and help you regulate your hunger. Understanding your diabetes care. This includes knowing which foods have carbs or how to calculate carbs, what your medications are used for, and what your goal or target ranges are for A1C or blood sugar. Chronic pain is another factor associated with diabetes distress. It can affect your quality of life, and it can also make it hard to fall asleep or stay asleep. Talk to your provider about options to help control your pain. It may be useful to get a referral for pain management, which can include physical, mental, and medical approaches. Talk to your provider if your current plan isn't working for you, and bring a list of your barriers. Include information about your personal life, family life, or cultural factors that may make it hard to maintain your care. If you need help changing your eating behavior, if you're concerned about your weight and skipping doses of insulin or other medications to help lose weight, you feel anxious, depressed, or overwhelmed, you are being hospitalized multiple times a year for diabetic ketoacidosis, or if you feel like it's getting harder to take care of your diabetes. Diabetes is only a part of your life. Remember to maintain friendships, daily routines, and continue to do your favorite activities. Talk to your provider if you're feeling depressed. Remember that you can ask family, friends, and your healthcare team for help and support if you're feeling overwhelmed or stressed. There are many resources available to help. You just need to ask. Take charge of your care. Thank you for taking the time to participate in Success with Diabetes. We hope that you have gained knowledge and tools to better understand your diabetes. We want to remind you that well-managed diabetes will allow you to continue to enjoy a fulfilling life. Thanks again.